Hello and welcome. Today, we're diving deep into a complex kidney condition known as renal dysplasia. We'll explore what it is, what causes it, how it affects the body, and what can be done about it. Get ready to learn about this important, albeit sometimes challenging, aspect of kidney health. So, what exactly causes renal dysplasia? Unfortunately, the etiology is often multifactorial and can be quite complex. In many cases, the exact cause remains unknown, falling into what we call sporadic occurrences. However, several factors are known to contribute. Genetic mutations, particularly in genes involved in kidney development, play a significant role. Environmental factors during pregnancy, such as exposure to certain medications or toxins, can also increase the risk. In some instances, renal dysplasia can be part of a larger genetic syndrome, meaning it occurs alongside other birth defects. Finally, urinary tract obstruction during fetal development can also contribute to abnormal kidney formation, resulting in renal dysplasia. To understand renal dysplasia, we need to look at its pathophysiology, or how it disrupts normal kidney function. Normally, the kidneys develop in a highly organized and precise manner. In renal dysplasia, this development goes awry. Instead of forming normal kidney tissue, the affected kidney or kidneys develop abnormally, often containing cysts, immature cells, and disorganized structures. This abnormal structure impairs the kidney's ability to filter waste and regulate fluids and electrolytes effectively. The severity of the dysfunction depends on the extent of the dysplasia and whether one or both kidneys are affected. In severe cases, renal dysplasia can lead to kidney failure early in life. When we talk about how common renal dysplasia is, we're entering the realm of epidemiology. Renal dysplasia is considered a relatively rare condition. It's estimated to occur in about 1 in every 500 to 1,000 live births. However, the true prevalence may be underestimated, as mild cases can go undiagnosed. It affects males and females relatively equally. It's important to remember that these numbers are just estimates, and the actual incidence can vary depending on the population and diagnostic methods used. The signs and symptoms of renal dysplasia can vary widely depending on the severity of the condition and whether one or both kidneys are affected. Some individuals with mild renal dysplasia may have no noticeable symptoms at all, and the condition is only discovered later in life incidentally. Others may experience a range of problems including frequent urinary tract infections, high blood pressure, swelling in the legs and ankles, failure to thrive in infants, and anemia. In severe cases, renal dysplasia can lead to kidney failure, requiring dialysis or kidney transplantation. Diagnosing renal dysplasia typically involves a combination of imaging studies and clinical evaluation. Ultrasound is often the first-line imaging technique, as it can visualize the kidneys and detect abnormalities such as cysts or an abnormal kidney structure. Avoiding cystoarthrogram, or VCU, may be performed to evaluate for vesicoureteral reflux, a condition where urine flows backward from the bladder into the kidneys. A renal scan can assess kidney function. Genetic testing may be considered, especially if there is a family history of kidney disease or other birth defects. Finally, a kidney biopsy, where a small sample of kidney tissue is examined under a microscope, can provide a definitive diagnosis, although it is not always necessary. Renal dysplasia isn't typically classified in a strict way, but it can be described based on the severity and the extent of kidney involvement. It can be unilateral, affecting only one kidney, or bilateral, affecting both kidneys. The severity can range from mild dysplasia with minimal functional impairment to severe dysplasia with complete kidney failure. We also sometimes classify it based on the presence of other associated conditions, such as being part of a genetic syndrome. The treatment and management of renal dysplasia depends on the severity of the condition and the presence of any associated complications. For mild cases with minimal functional impairment, regular monitoring of kidney function and blood pressure may be sufficient. More severe cases may require medications to control blood pressure, treat urinary tract infections, and manage electrolyte imbalances. In cases of kidney failure, dialysis or kidney transplantation may be necessary. Surgical intervention may be needed to correct any urinary tract obstructions. A multidisciplinary approach involving nephrologists, urologists, and other specialists is often essential for optimal management. Unfortunately, there's no known way to completely prevent renal dysplasia, particularly when it's caused by genetic factors. However, pregnant women can take steps to reduce the risk of certain environmental exposures that may contribute to the condition. This includes avoiding certain medications, toxins, and alcohol during pregnancy. Prenatal care and ultrasound monitoring can help detect kidney abnormalities early on. The prognosis for individuals with renal dysplasia varies greatly depending on the severity of the condition. Individuals with mild unilateral renal dysplasia may live relatively normal lives with minimal or no long-term complications. However, Individuals with severe bilateral renal dysplasia are at a higher risk of developing kidney failure and requiring dialysis or transplantation. Recent research has focused on identifying the genetic causes of renal dysplasia and developing targeted therapies to improve kidney development. Additionally, advances in dialysis and transplantation have significantly improved the long-term outlook for individuals with kidney failure. We are consistently learning new information that will lead to improved lives for those affected by renal dysplasia.